Hey everyone, welcome back to Alpha Insights. I'm Brittany.
And I'm Jordan. We've got a pretty interesting morning in the cannabis space to walk through.
And hey, if you have questions while you're listening, drop them at stockalpha.ai. We check those and answer them on air.
Right, so the big headline is the FDA giving breakthrough therapy designation to VER-01, a cannabis-derived full-spectrum pain drug that just reported positive Phase 3 results.
Exactly. 2 randomized Phase 3 trials showing meaningful pain reduction, and importantly, no sign of dependence, which is the kind of safety detail regulators and clinicians care about.
Breakthrough therapy status basically signals the FDA thinks this could be a substantial improvement over what's out there. And it usually means faster, more hands-on discussions between the company and the agency.
So, the real question here is how that changes the picture for the whole sector. Personally, I think it makes clinical cannabis plays feel more mainstream to big money.
I agree. Analysts note this kind of regulatory nod can attract institutional interest and funding toward biotech projects using botanical cannabinoids rather than just retail or recreational plays.
And that could push capital into companies that are actually running clinical programs, not just selling flower and edibles.
That said, there are some pretty loud local headwinds we need to weigh against the FDA buzz.
Kentucky is the first big example. State lawmakers are trying to block the governor's expansion of qualifying medical conditions, asking the attorney general to tell agencies not to implement the order.
Which is a reminder that even if Washington or the FDA moves, state politics can still slow patient access and local revenues. So rollout risk varies a lot state by state.
Yeah, and if agencies are told not to cooperate, licenses, patient registries, even dispensary revenues can get delayed. So momentum at the federal level doesn't erase state friction.
And then there's labor. Workers at an Ascend Wellness site in Illinois authorized a strike by a 92% margin while negotiating their first contract under the Teamsters.
That's significant. A 92% authorization vote is a clear message. Union momentum is real in retail-heavy operators. And that can create margin pressure or retail disruptions.
Right. Companies with a lot of stores or large cultivation footprints are the most exposed. Analysts will be watching bargaining updates closely because a strike or prolonged negotiation changes near-term cash flows.
On the brighter side, there are product and operational wins worth noting. Onyx had multiple podium finishes at the New Jersey Cup, and Slapwoods is growing its brand with natural leaf cones that cater to blunt culture.
Those consumer wins matter. They show product quality is improving and that brands can actually build loyal followings, which is a different value driver than just production volume.
And speaking of production, the automation conversation is getting smarter. It's not just buying bigger machines, it's creating a framework to scale efficiently. That could separate efficient operators from the rest.
So what's the market watching today? Expect the broad cannabis ETF and individual names tied to both retail and therapeutics to be more volatile as traders price the FDA news against state and labor risks.
Specifically, keep an eye on big retail and multi-state operators like Trulieve, Green Thumb, Curaleaf, and Tilray, plus the U.S. cannabis ETFs that track sector flows. Analysts note those names may react quickly to any follow-ups from the FDA or spillover state actions.
And remember, this is informational analysis only. We're not giving personalized investment advice. Market moves can be fast and nuanced, so watching price and volume matters.
Totally. Quick reactions.
Right.
Okay, to wrap up, 2 quick takeaways from me. 1. The FDA breakthrough for VER-01 is a legitimate sector catalyst that could pull more institutional interest toward clinical cannabis. And 2, state politics and labor actions are real, present risks that can blunt that momentum.
I'll add this. Watch companies that publish clear automation or efficiency plans, and keep an eye on any FDA communications or Kentucky legal filings. Those signals will tell you whether the optimism is durable or just a head fake.
Got questions? We'd love to hear from you. Head over to stockalpha.ai, where you can ask us anything and we'll answer live. And while you're there, check out more market content and our Q&A feature.
Thanks for listening. We'll be watching how market participants price this throughout the day. See you next time on Alpha Insights.